Hi everyone, it is 8 months and 2 weeks post-op. Those of you new to this channel, thank you for tuning in. In March of 2020, I had a rare and controversial surgery called pudendal nerve decompression surgery. The pudendal nerve is one of the main nerves in the pelvis. I've had chronic intractable pain since 2013. And I had undergone a variety of treatments that were not successful. And 7 years later, I decided to embark on a journey that would take me to Phoenix, Arizona to meet Dr. Michael Hibner, who is one of the top surgeons in the country for pudendal nerve decompression surgery. Basically, they go in, cut the sacrotuberous ligament in the pelvis, and follow the pudendal nerve along its pathway and clear it of any scar tissue. The surgery is a very long recovering surgery. Most people don't see any improvement until up to a year post-op. Most people that I've talked to have not seen improvement for 2 to 3 years. However, it seems like the general consensus is that 2 years is kind of when people find themselves most recovered. They say anywhere from 4 to 8 months, some people notice improvement, but the improvement is not a gradual improvement. It usually is a sudden improvement, and it usually happens in a short amount of time. I am 8 months, 2 weeks post-op, and also still on my medical journey. In August of 2020, I discovered another whole dimension to my medical issues. I began to explore the vascular compression route. There are 3 separate vascular conditions that can contribute to pain, one being May-Turner syndrome, second being Nutcracker syndrome, and third being pelvic congestion syndrome. It was discovered after a venogram with intravascular ultrasound that I have all 3 of those things. I had a stent placed in my left common iliac vein due to a 73.5% compression. And it's been about a month since I had the stent placed, and I have noticed some improvement of my symptoms. I still have neuropathic pain, mostly revolves around eating and having bowel movements, and occasionally just going to the bathroom in general. But I do notice that the stent placement has definitely improved my abdominal symptoms. I still have episodes of intestinal pain that contributes to like my abdominal pain, but I do believe that the vascular compressions were an issue with blood flow. But my latest and most mind-blowing discovery was the fact that I believe I have Ehlers-Danlos syndrome, which is a genetic condition that affects collagen production, and collagen production makes your joints, ligaments, blood vessels all hypermobile. I do believe that I'm on the hypermobile spectrum. However, I do not know which type of Ehlers-Danlos syndrome that I have. It is all just guessing at this point. There are doctors that do genetic testing or that are EDS specific doctors, but they are in Indiana. I'm having some of my other doctors, my physician and my gastroenterologist, are trying to help me do research to see if there's any other genetic counselor or doctor that I can go to that is more close by. I don't believe there is upon doing research. I'm willing to travel to Indiana at this point to get the genetic testing done. It's just really opened my mind. A lot of the symptoms that I've been experiencing since childhood make a really lot of sense, and a lot of really little things that I didn't really piece together kind of fit into this puzzle. I do have the velvet skin. I have very hyperextendable skin. I have certain joints of mine are hypermobile. There's a couple of movements that I can't do that other people with EDS can do. However, everybody with EDS has such a different presentation. of such symptoms, and some people's are more severe than others. Everybody is so different. I actually joined a support group tonight. It was a Zoom meeting with about 20 people. The EDS Society's website has support groups monthly, and I think there's every other week there's something. And it was really awesome to be able to see other people and hear them talking about things that are just so common, like the dysautonomia, the dysfunction of the autonomic nervous system, circulatory issues, pain issues, just everything like that. And it's all finally coming together. It sucks that it took me 7 years to figure this out, but a lot of people with EDS go a hell of a lot longer without knowing that they have this condition. And I'm really hoping to have this diagnosis on paper at some point, even without the genetic testing, because that will help me with disability if I get denied. It's just yet another piece of evidence that I can present. I am still waiting to hear from disability. Probably will get denied pretty soon, because usually the first time through you do get denied because they don't really know these conditions. But maybe I'm wrong. Who knows? It's really all up in the air at this point. Physical therapy I go to twice a week at a pelvic specific facility that I really, really enjoy. For those of you that are new, my main symptoms are left-sided pelvic pain, left-sided abdominal pain, and leg pain, and just really on the left side of my body. And gastrophoresis, I believe. What I've been experiencing for many, many years is small herniations of the intestines in some form or fashion, or extreme gastrophoresis. Every time that there's solid food in my intestines, I have an immense amount of discomfort, and it presents itself by pushing on my pelvis and pushing on my ligaments in wrong ways. And also, people with EDS have faulty ligaments that hold up the organs. So the organs that are in my abdominal cavity are not being supported properly. So it can lead to all types of issues with functional things of the organs and such like that. So it's really hard to also have a normal exercise routine, because I'm just terrified of getting injured or rupturing a blood vessel or something. But I do know that I need to make sure that my muscles don't atrophy as a result of just laying in bed all day. I try to go for a walk at least once a day, if not twice a day, to keep my muscles going. There's also a book that I found for diet for EDS, and basically there's a couple of different amino acids that we need an excess of in order to strengthen the existing collagen that we have, albeit defective collagen, and also the synthesis of new collagen. So basically bone broth, gelatin, proline, glycine, vitamin C, and zinc are super important for people with EDS. I'm starting to meet more people that have the culmination of issues that I do. So not only just EDS, but vascular compressions, neuropathic pain. I've met people that are very similar in presentation to me, although not exact. But I do have an exact clone out there, and it's a male, and he lives in Canada, and it's actually pretty freaky. But we have the same presentation, the same diagnoses, and the same onset of symptoms, which is super rare to find. Normally I find people with just one of the many things that I have wrong with me, but it was super awesome to be able to connect with them. So basically right now I'm just waiting to either get a new doctor to get the diagnosis on paper, or go to see a genetic counselor, whether that's online or whether I have to travel to see if I have one of the more serious or less common types of EDS, because at this point I don't know what type of EDS I have. And hopefully it's the most common one and the least serious. However, until I have it ruled out, I just really don't know. So, wish me luck, and that's really all I have to report. Just getting pretty lonely. I haven't really seen anyone in person in other than my parents and doctors in several months, and everybody's getting COVID now. So it's been really hard. It even now with the holidays coming around, it's going to be even harder to try to even see people in person. So I'm going to probably have to wait until January or February to see anyone in person after all of it passes, or hopefully at least dies down. The holidays are just another day to me. I've never really been super thrilled to be in huge gatherings or whatever. It just drains a lot of my energy. So, I just think it's, for me, more memorable to celebrate birthdays or anniversaries than it is for holidays for me. Yeah, that's pretty much it. I'm just trying to keep my mental health in check at this point, because just all the revelations that just came to me so quickly after this surgery. When it comes to pudendal nerve decompression surgery, if anyone is considering doing the surgery, what I have to tell you is don't do it until you go down every single other avenue that could be contributing to your pain. Had I known that I had EDS prior to all this, I would never have had this surgery, I don't think, because people with EDS take a lot longer to heal from surgeries, even simple surgeries, than the rest of the population. But hindsight is 2020, and I do think my nerve was very badly damaged due to the fact that my connective tissues, my ligaments were just not, they're faulty. So it makes sense, but rule out everything you can possibly rule out prior to surgery, and most doctors won't even accept you until you do that anyway. But your issue may not be in the field of pelvic pain. Your issue is maybe outside of the field of pelvic pain. So don't just trust the pelvic pain doctors that say, you've tried everything, go for surgery. No, you need to visit other disciplines. You need to visit vascular, you need to visit gastroenterology, you need to visit even rheumatology, anything and everything. Go to a genetic doctor, get tested for rare disorders before you have nerve surgery, because it is a brutal bitch of a year to heal from pudendal decompression surgery, and I have yet to know if it's going to help or not, because I haven't seen any improvement. I believe the improvement that I've seen is all due to the stent placement. So better late than never for me, but I'm still trucking along. Thanks for watching, and I will talk to you guys next week.